Hello, hello. We are back with Module 3. All right, we're going to talk in Module 3 about the health conditions emerging around menopause. And just to remind you that this video series is not medical advice, it's education, it's information. And I want you to get this knowledge and be able to then go to your doctor or your provider, your nurse practitioner, your physician's assistant, whoever that is, that you can then talk to them and you're more informed. It's also, there's a little bit of advocating. And if you find someone who's very resistant to listening to you or acknowledging that your symptoms can be related to perimenopause, it might mean you need a different provider. Okay. I also want to make sure you know that I am not paid by a drug company or a lab or an imaging company. And I think I haven't really said it before, but I am not being paid by some big hormone therapy website or anything. I'm an independent certified menopause provider, and I'm not even needing or wanting more patients in my practice. What I want is for you to be able to have this information to go to your own providers and have that knowledge. Okay. So that's really the goal here. We're going to talk in this lesson about musculoskeletal and joint health, okay, and how this is affected by menopause. And the risk is for osteoarthritis. So, what we commonly most people think of as arthritis is increased during perimenopause and menopause. I am a living, breathing, sufferer from osteoarthritis in my hands, and it's not uncommon. Now, this is different from rheumatoid arthritis. Okay, that's something different. That's an autoimmune disorder. So, but osteoarthritis is something that usually has an onset in menopause or perimenopause in various joint pain. Joint pain isn't necessarily from arthritis, but it can be from the changes from lowered estrogen levels. So, estrogen has this protective effect on our cartilage and connective tissue and our bones. So, as those levels decrease, that can just cause, those changes can cause some joint pain. It's not necessarily arthritis. Arthritis is inflammation in the joints. So, and it can develop those. So, it's good to go and see your provider. Yeah. Now, besides joint pain, you can also have stiffness in the joints, whether it's your knees, your hips, shoulders. There's a lot of, how many women out there have had frozen shoulder where they're just not able to move their shoulder as well? So, reduced mobility. These are very, very common symptoms that can develop in perimenopause and menopause. And it just hasn't been recognized that it's potentially a sign of someone, maybe before you're having hot flashes or night sweats, or maybe you're only having a little bit, you're not realizing that this is actually from decreasing estrogen levels. Not all joint pain, again, is arthritis, and not all joint pain is normal. So it is important to be evaluated. Okay. Osteoporosis is the other main thing that happens with joints and bones. So osteoporosis is a condition where the density of your bones is thinner to the point where you're at higher risk for a fracture. If you fall, you're more likely to break something, break your arm, break your hip, break your leg. So it is important to prevent osteoporosis as we age. When estrogen levels decrease, that accelerates bone resorption. So what does that even mean? So bone turnover is something that is constantly happening. Bone isn't just created and stays the way it is. Bone is constantly turned over. So your body absorbs the bone and deposits more bone. So it's constantly turning itself over. But with estrogen levels decreasing, there's more resorption than depositing of more bone. Okay, so turnover rate is higher and resorption is higher, so you end up with a lower bone density, and that increases your risk for fractures, or we call fragility. So now, interesting, we talked before about resistance training, keeping your muscle mass, okay, is very important. not just for the insulin resistance that we talked about before and, keeping from gaining weight, but maintaining your muscle mass is important for preventing bone fractures also and joint injuries. So this is all plays into the same thing. And resistance training also helps your bones stay strong because you're lifting those heavier weights. So everything we're talking about all interplays with each other. So again, we want to prevent osteoporosis. Risk factors for osteoporosis besides menopause is just age. So men get osteoporosis too. Okay. And then genetic factors. So if you have a family history of osteoporosis, we're more likely to order a bone density test earlier. Smoking increases your risk for osteoporosis. Alcohol, poor nutrition, which is we associate with a lot of alcohol intake, low calcium, low vitamin D intake, and inactivity. So if you're not active, like I was, doing that weight bearing exercise actually helps your bones to be strong. So if you don't do a lot of that and you sit around a lot and you don't do exercise, that is going to increase your chances of osteoporosis. And if you don't take in a lot of, calcium, which is mostly in dairy, or you also get calcium from certain vegetables and other foods in your diet, if you're not getting that, then that will increase your risk for osteoporosis, as well as a lot of alcohol intake and smoking. So what do we do to screen for low bone density? So by the way, low bone density or low bone mass that isn't yet osteoporosis, we call osteopenia. But osteoporosis is where it's so thin where you're really at that higher risk for fractures. But to check that, we do a bone density scan or a DEXA scan. And most of the time, insurance will pay for that if you are in menopause or if you lost height, then insurance will pay for it, or if you have a strong family history. Prevention is to make sure you're getting enough calcium. So if you don't think you're getting enough calcium from your diet, and this is something you talk about with your provider, you may want to take a supplement. You don't want to take too many calcium supplements or get too much calcium even from your diet. Too much calcium can increase your risk for kidney stones. So just make sure you discuss that with your provider. Usually one supplement a day is plenty, and make sure it has vitamin D. Some people need extra vitamin D, especially if you live in somewhere where you're not getting a lot of sunshine. And if you don't ever go outside, then you're going to need vitamin D. A lot of people in the Northwest, where I'm located, need extra vitamin D. And then preventing by doing weight bearing exercise. There's some studies looking at like 30 seconds of jumping once a day can help prevent osteoporosis. But, go for those walks, lifting weights, and so weight bearing exercise. And then treatments for osteoporosis include hormone therapy, actually can help prevent and treat osteoporosis. Bisphosphonates, that's medications that you can take once a week or once a month by mouth. You may have heard of something like Fosamax or Actonel. And then there's other agents. There's like a nasal spray for something called calcitonin. There's various other medications, which I'm not going to cover now. There's IV infusions you can have for the treatment. Well, it's not really prevention, but for treatment of osteoporosis. So there are medications to treat it, but it's not as good as preventing it. So key takeaways here is just that osteoarthritis and other joint aches and pains arise after menopause or during perimenopause due to the loss of estrogen. And then osteoporosis also can develop with a loss of estrogen because of the faster bone turnover, right? And we wanted to focus on prevention of osteoporosis and of fractures. So we're going to, do weight bearing exercise, lift weights, make sure we're getting enough calcium and vitamin D, and avoid alcohol or too much alcohol, avoid smoking. All right, see you next time.